is Aarti Batra and I am a Javed Abidi fellow at NCPEDP. I am also a person with thalassemia and now an academic as I've started to pursue my PhD. So as I told you, I am a person with thalassemia. Thalassemia is basically a blood disorder where you require constant blood transfusions. So I need to access healthcare very regularly and health interventions are basically part of life. I was mostly dependent on public healthcare services. I realized that there is lack of accessibility in services as basic as that blood is not available in most of the hospitals. A net tested safe blood that can be transfused to a human body is not available. I think that whole experience of 25 years just made me realize there's a lot to be done, a lot to be talked about, but the issue is people are just supremely unaware of it on all levels. From the ground level, most of the patients also don't have zero awareness on where to go, which doctor to consult, which hospital to go to find blood, where to get the medication, where to get medications for free. And then there's another lack of awareness at the institutional level where doctors are not aware of things. Administrators are not aware of things. My work was mostly around healthcare. What I did was I did a baseline study, I did a primary study. In Gurugram district of Haryana, we tried to assess how primary healthcare centers, which are the first point of contact underprivileged individuals when they contact healthcare, how accessible are they? Like, are they even getting the basic healthcare necessities for something as common as fever? So now I'm working on something very similar, that how first-person narratives can contribute to the medical studies. We train them around early symptoms of each 21 disabilities that can be caught on like a 6 month age. It is just like a developmental milestone checklist. By the 6 months you shouldn't have these symptoms. By 1 year you shouldn't have these symptoms. And if you have these symptoms, please go to a medical practitioner and get it checked. So that is what we have been doing. When I entered in the fellowship, it was all that I knew about was my personal disability, that was thalassemia, and a couple of other blood disorders. But I was put into a space where there are myriads of disabilities, there are myriads of chronic illnesses, and every disability has unique needs, unique awareness points, unique challenges and different recommendations towards it. If I would not have gone into the fellowship program, I probably would not have discovered all the different kinds of issues we are facing, all the different kinds of disabilities we are facing. So yeah, the fellowship widened my perspective towards the world, it empathy in me, and yeah, I'm a better person because of it, I think.